Welcome to A to Z Nursing Vlogs. This video is an introduction to the nursing care plans. Let's begin. Writing a best nursing care plan requires a step-by-step approach to correctly complete the parts needed for a care plan. Nursing care planning begins when the client is admitted to the agency and is continuously updated throughout in response to the client's changes in condition and evaluation of goal achievement. Planning and delivering individualized or patient centered care is the basis for excellence in nursing practice. What is a nursing care plan? A nursing care plan is a formal process that correctly identifies existing needs and recognizes potential needs or the risks. Care plan provides communication among nurses, their patients, and other healthcare providers to achieve healthcare outcomes. Without the nursing care planning process, the quality and consistency of patient care would definitely be lost. Let's see the types of nursing care plans. Care plans can be informal or formal. An informal nursing care plan is a strategy of action that exists in the nurse's mind. A formal nursing care plan is the written or computerized guide that organizes the client's care information. Formal care plans are further subdivided into standardized care plans and individualized care plans. Standardized care plans specify the nursing care for groups of clients with everyday needs, whereas the individualized care plans are tailored to meet the unique needs of a specific client or the needs that are not addressed by the standardized care plans. Let's move on to the objectives. The following are the goals and objectives of writing a nursing care plan. Number 1. Promoting the evidence-based nursing care and to render pleasant and familiar conditions in hospitals and health centers. The care plan supports holistic care which involves the whole person including physical, psychological, social and spiritual in relation to management and prevention of the disease. It establishes programs such as care pathways and care bundles. Care pathways involve a team effort in order to come to a consensus with regards to standards of care and expected outcomes, while care bundles are related to best practice with regard to care given for a specific disease. It identifies and distinguishes goals and expected outcomes. It reviews the communication and documentation of the care plan and measure the nursing care. These are the goals and objectives of a nursing care plan. Let's see the purposes of a nursing care plan. It defines the nurse's role. It helps to identify the unique role of nurses in attending the overall health and well-being of the client without having to rely entirely on a physician's order or the interventions. It provides directions. It allows the nurse to think critically about each client and to develop interventions that are directly tailored to the individual. Number 3. The nurses from different shifts or different floors can use the data to render the same quality and type of interventions to take care of the client, and therefore it allows the clients to receive the most benefit from the treatment. It should accurately outline which observations to make, what nursing actions to carry out, and what instructions a client or the family members require. If nursing care is not documented correctly in the care plan, there is no evidence the care was provided. There are instances when clients' care need to be assigned to a staff with particular and precise skills. So it serves as a guide for assigning a specific staff to a specific client. It also serves as a guide for reimbursement. The medical record is used by the insurance companies to determine what they will pay in relation to the hospital care received by the client. It does not only benefit the nurses but also the clients by involving them in their own treatment and care. In that way, it defines the client's goals. These are the purposes of a nursing care plan. A nursing care plan has five components. Number one is the client's health assessment and the medical records. This is the first measure in order to be able to design a care plan. In particular, the client assessment is related to the following areas and abilities like physical, emotional, sexual, psychosocial, cultural, spiritual, transpersonal, cognitive, functional, age related, economic, and environmental. Information in this area can be subjective as well as objective. The second component is the expected client outcomes are outlined. These may be long or short term. Number three is nursing interventions which are documented in the care plan. Number four, the rationales for the interventions in order to be evidence based care. Number five, definitely evaluation, and this documents the outcome of nursing interventions. These are the five components of a nursing care plan. Nursing care plan follows specific care plan formats. Usually, the nursing care plan formats are categorized or organized into four columns: nursing diagnosis, desired outcomes and goals, nursing interventions, and evaluation. Some agencies use a three-column plan, whereas some use four-column plan, and the rest may use five-column plan. A three-column plan format appears like this, where it contains diagnosis, outcomes, and evaluation together in one column and the intervention in a separate column. The four-column plan format appears like this: the diagnosis, goals and outcomes, interventions, and evaluations. Some hospitals or agencies use a five-column plan that includes a column for the assessment cues separately. Student care plans are more lengthy and detailed than the care plans used by working nurses because they are learning activity for the students. Care plans by student nurses are usually required to be handwritten and have an additional column for rational or scientific explanation after the nursing interventions column. Rationals are scientific principles that explain the reasons for selecting a particular nursing interventions. These are the different nursing care plan formats.